And we're live.
All right, good afternoon. I'm Alexis Siebold. I am an occupational therapist at Positive Steps Therapy, joined again by Dr. Lisa Hwang from Caring Hands Pediatrics.
Good to see you.
Good to see you too. We did a Facebook Live, I think at the end of June, and we talked about successful transition to kindergarten. And during that conversation, we talked a lot about social and emotional regulation and found out that that's really a topic that needed its own Facebook Live and conversation because it's something that is really prevalent right now. So today we're going to talk about the effects of poor social and emotional regulation, and then what families and caregivers can do for their children and adolescents to help facilitate something better for them. So I think first, it would be a good idea to talk about what exactly is emotional regulation and how that kind of relates to pediatrics and adolescents. So I believe a slide will come up to show us what emotional regulation is. But self-regulation is the regulation of emotion, is the ability to respond to the ongoing demands of an experience with a range of emotions in a manner that's socially tolerable and sufficiently flexible to permit spontaneous reactions, as well as the ability to delay spontaneous reactions. So in layman's terms, it's the ability to kind of respond socially to something that we didn't expect and hold back reactions that feel spontaneous. So in kids, this is like, blurting out something that is how they feel, versus when we see something that surprises us or makes us mad, we kind of think about it for a second, take a deep breath, and then we respond how we know is socially acceptable. So therapeutically, what impacts emotional regulation, or what can, are difficulties with communication, difficulties understanding and taking perspective of others. And then also something that we'll touch on eventually is misdiagnosed as a sensory or a behavior. So a lot to kind of delve into, but it's definitely something that is prevalent and, like anything else, needs taught to kids as they mature. So I also have some milestones too, just to kind of give everyone an overview of what age should we expect these, maturity and the ability to regulate our emotions. So I'll wait till that one pops up just as a reference. So, the chart here starts at 0, goes up to 2, and then we have one that even goes up past 12. If we could go to the like 2 to 3 years, 4 to 6, that next one, because this is where kids enter school at a lot of these ages. They join peer groups, they join a sport. So as you can see, at 4 to 6, they start to show that empathy. They have some self-control over anger or disappointment, and they're starting to really discuss their emotions. When we go from 6 to 12, we really start to see that self-control, respect for authority, and then 12 and beyond, dealing with puberty and all of that emotional turmoil in itself. But you can see as they build, as they get older, it's good that they're building also on this emotional maturity too, so that once they really start to engage in some of these harder lessons or harder scenarios, they've already had the experience as they were younger of how to work on their emotions appropriately. So Dr. Hwang, are you seeing this in your practice as parents how are they kind of describing some of these topics with their kids?
Yeah, so it does depend on age, like you said, and parents will say that their kids are having trouble kind of dealing with their emotions. And so if you think about a 2-year-old, they have temper tantrums, and we kind of expect that, they just don't know what to do with that rage. So they act out and they start screaming and crying. But that's not appropriate, as you were mentioning before. It's not appropriate socially for, say, a 12-year-old or a 40-year-old to have that kind of temper tantrum. You have a little bit of a filter, and kids are still learning that, and they can't they just know they're mad in this moment and I didn't get what I wanted. And that's, that's what it is. Parents are saying that their kids are angry, lashing out at others. I don't really know how to deal with those temper tantrums and how do I manage that? And a lot of it is education. If you think about over time, you kind of learn how to manage your emotions, at least hopefully you do as an adult. But, you don't just start laying on the floor, kicking and screaming. Parents might notice that the younger kids will have temper tantrums, or they're crying, or they're hitting, or they're pushing other kids, biting other kids. And a lot of that is just out of frustration and not being able to regulate those emotions. They don't know how to deal with them or what's a better way to do that. Older kids might be yelling at their siblings, fighting, and some other things they might do is to seclude themselves in their room. So, people talk about kids they're not coming out, they're not doing anything. I hear parents say that all the time. I don't even see them all day. They're I have to call them to come eat and they're just in their room, or they're crying a lot. And the older kids, like teenagers, you'll see a lack of motivation or just, again, staying in their room. One of the things with the older kids you do want to watch out for is drug or alcohol abuse, and sometimes, or not just the like vaping too, cigarette smoking, marijuana, there's a lot of that. And sometimes parents aren't aware of that. That's something to kind of have on your radar, because, when I talk to patients, sometimes that'll come out during the visit and parents aren't necessarily aware. So I'd kind of watch out for that kind of thing. And I think that the pandemic has created a lot of stress for everyone, regardless of what your age is. And some of that is related to spending more time. I think people are now spending almost too much time with their families. It's a little bit better now because things have opened up a little bit. But if you think back at the beginning, where it was 24/7 with family and siblings, and I hear that a lot from parents. Oh, they're just fighting all the time over everything. They're getting irritated with each other. And part of the problem with this is not having enough time to socialize with other people. Sometimes it's not good to spend 24/7 with the same people all the time. You need a break. But, they haven't been able to socialize with their friends. And socialization is such an important part of your mental health. And, kind of spending time with your friends can make you feel better. You can vent, but it's just, we're humans and we're social animals. And so kids really need that. Being able to communicate with other people really impacts our well-being. And sometimes not being able to communicate well can lead to frustration and misunderstandings. And that's where speech and communication kind of ties into some of that. What are you seeing, Alexa, in terms of the speech portion of it?
Yeah, this is something that as an OT, I was enlightened over the pandemic of how important speech therapy is with this emotional regulation, because, we obviously as OTs handle the behavior side, the sensory side of things, but our speech therapists are really integral parts of the therapeutic process. So, delays in any of the receptive or expressive language, which speech therapists are already working on with kiddos who might have, speech impediments or speech delays, is the same for these emotional regulation kids. So with receptive language, the decreased ability to really understand simple verbal directions from someone that we know, or maybe someone that we don't know, like a teacher or someone of authority. If the child isn't understanding, they may get frustrated. They may feel like they need to lash out because they don't understand what's expected out of them. So working on that receptive language piece is really important. And then in the same hand, that expressive language, so the way that we express ourselves, it's sometimes just the matter of finding the right word. We have kids who all they know is mad, sad, angry, or happy. But sometimes it's not one of those four words. Sometimes it's I'm frustrated, or I'm scared, or I'm nervous. So finding the right way to express how they feel is also really beneficial. So they understand what the differences are that their body feels per se. So that is something that I love to loop in with social and emotional kids when I see them is that speech therapy aspect. And as soon as I explain it that way to parents as well, it starts to make sense. They kind of take for granted that that's not something that everyone just picks up on, the ability to express that themselves. So sometimes it takes a little extra coaching on a therapy end for sure. So the ways that speech therapy can help specifically is working on increasing basic communication, like following directions, requesting, increasing their overall vocabulary, increasing their utterance length. So maybe with these kids who are just doing 1 or 2 words, working on increasing how many words they're able to get out, and then properly answering yes and no questions. That way, these kids are set up for best case scenario to advocate for themselves. And then parent education, of course, just working on all that early language skills and how to help their kids as best they can as well. Yeah. So we kind of talked about like the pandemic and communication, but I also do a lot of education with parents with the way that social media and working via the internet for so long has really impacted the kids' ability to communicate. Have you seen any trends with this as well, with the pandemic, with ways that kids are communicating and how that's affecting all this as well?
Yeah, that's a big issue these days. All these kids are on social media. But I did want to make a comment just when you were talking about the younger kids and speech therapy, because go back to the 2-year-olds that are having temper tantrums. Sometimes it's because their speech isn't good yet and they can't communicate what their wants are. And so some of those behavior issues are related to frustration with communication. So if you think about this 2-year-old and there's something that they want and they keep saying the same thing over and over, they're screaming out this and you're just not understanding what they're saying. They're not getting what they want. They have a temper tantrum because you're not, meeting their needs because they're asking for something. And they have a temper tantrum, and sometimes parents are like, oh, they're so bad. They're just like crying. And well, why are they crying? They're crying because you're not responding to what they're trying to say, because they can't communicate what it is that they want. And a lot of times those kids, as they get a little bit older and they can express what it is, you don't have as many of those temper tantrums. And so I think parents need to also realize, well, what started this temper tantrum, or what was the child trying to convey, or what were they trying to ask for? And sometimes that's kind of where the breakdown is. But
we've got a question from the audience. Is this part of why some children have difficulty identifying their needs? An example would be an early teenager, when asked about feelings, often answering, I don't know, but yet clearly they are frustrated.
Right. And that's a huge source of frustration for kids and parents. I mean, I get a lot of that. I don't know. And I'll usually push it a little bit because oftentimes they do know. But keep in mind, sometimes they don't know. They just know, you know what, I don't feel great and I'm irritable and I don't really like what, I don't trust anything my parents say and you can't help me anyway. So sometimes it is a little bit of digging a little deeper to figure out what it is that is affecting the child. Sometimes people are, oh, it's a teenager, they're just always crabby and they, just, if you ask them any question, it's all, I don't know. Mm-hmm. But sometimes if you kind of figure out what the source of their stress is, because they're not going to say, oh, I'm anxious or I'm depressed. So right. That communication is an issue. And sometimes talking to the pediatrician or the therapist can be helpful there. Sometimes when I have parents step out of the room and I examine the kids, I'll ask them a few questions, and sometimes things will come out there. And it's kind of tricky trying to figure out what the issue is, but that's where the communication helps to kind of, break that barrier with the teen. It takes a little bit of skill in trying to figure that out, how teenagers are. So that can be difficult.
I think the trick with older kids too is our job isn't to figure out all their deep, dark secrets. And that's why we want to help them express the way that they are, but just a healthy way to express what they feel like, because, a 16, 17, 18-year-old is still not realizing if things compound for so long, this is what it turns into in the long run, right? They don't have that like executive functioning to think that far in advance yet. So that's what I want to help out with like the adolescents, is to say, it's not me just wanting to know everything that's wrong with you. I want you to understand how you feel and other outlets that you can take so that it's not a long-term feeling. And then that makes them feel a little bit more comfortable, because sometimes I think they think that we're on mom and dad's side all the time and caregiver side, and we're like part of a secret mission to understand what's going on and just have them talk about their feelings all the time. But really, it's just, we want them to have an outlet, a comfortable outlet, whether that's writing in a journal or, keeping themselves organized so that they don't get stressed out. That's really, we're there to be a problem solver with them.
Yeah, I would agree with that. I also think that some kids aren't comfortable just talking about stuff. So they really, truly don't want to talk about it. But the other thing that I've occasionally heard kids say, well, it doesn't matter, you're not going to listen to me anyway. And so I think some kids feel like their parents aren't listening. And it may not exactly be listening, but not hearing what they're really trying to say. And there's this disconnect between what people are saying, what people are interpreting. And it's very individual, though. It depends on the child. There's different issues. So, but it can be difficult to break that wall and try to get through there.
And that's such a good point, because I coach some of my parents to say, no matter the age, when a child comes to you, when they start really expressing their feelings, when they're trying, always come up with at least one solution. Even if it's, let's just go downstairs, or, here's some gum or something like that, because then they're realizing, okay, I brought the way I'm feeling and it didn't fall upon someone who's just not listening to me.
Right.
So just one solution is all you need to give them. It doesn't have to fix the problem per se, but it helps with that. I tell my parents something and it doesn't matter,
Right. I feel like that happens a lot. And the other thing is to kind of work with the child to come up with a solution, because sometimes I'll ask the child, okay, well, you give me the solution to what do you think would you like to see happen? Or what do you think a solution to this is? And I think part of it is sometimes kids feel like, oh, they don't get to decide anything. I think they sometimes feel like, I'm old enough, I can make decisions, which is true to some degree, but nobody's listening to what I have to say. And I think it helps to get the child on board with some solution generating.
Yeah, and that's great for their executive functioning problem solving skills too.
Right.
As you're an active part of this.
Right. And that does build those skills as well. So I think in the long term, it's helpful for kids to do that as well.
Yeah, definitely.
Yeah. Back to the social media piece of it, though, I feel like, clearly most kids are on social media these days, and it has good and bad features to it. Through the pandemic, being isolated was tough, and social media is one way to stay in touch with friends. There's fun parts of it. You can communicate. It's social, you can communicate with friends. It's fun to see pictures. And I enjoy seeing some family members that we don't see very often, and I get to see pictures of, or my friends' kids or whatnot. And I think that that's a great thing. But, what happens when you're a kid and you see pictures of your friends at a party that you didn't get invited to? What happens when you see a post that your friend posted something negative about you and it wasn't true, but now it's there for everyone to see? It makes people feel bad about themselves. Or you see all these other girls posting pictures with their boyfriends and you don't have a boyfriend, and you internalize that, and it makes you feel bad. So I feel like a lot of the anxiety and depression that we see today kind of gets exacerbated through social media. And so I tell patients all the time, sometimes you just got to shut that stuff off. It's this alternate reality. It's not really how people feel inside, but it can really make you anxious. It's there 24/7 in your face. And people are, I got to get so many likes. It's a popularity contest. I got to get so many streaks. And I think there's this heightened, I got to do all this stuff all the time, And then back to the language related to social media, there's a lot of misinterpretation based on the printed word. So for example, if somebody were to type, "you like him," well, it would be one thing. If we were talking to a person, they might say, "Oh, you like him."
Yeah.
Or that sounds very different than "you like him," or "you like him." It can come across very differently. And we just, we have emojis, you can put an exclamation point at the end of it, but there is so much variability in terms of how people are going to interpret those three little words or whatever words they are. And I think that, causes a lot of problems. I mean, adults, you see it with them too through social media, where people are misinterpreting, and you'll see it go back and forth. And so it's bad enough as an adult, let alone a teenager or a younger child, that really, how do I wrap my head around this? I just know that makes me feel bad. But it's hard to step away from it and say, okay, wait, that's not real, or I'm not going to let that bother me. It doesn't work that way in kids and teens. It's really hard to kind of get past that, or get past those emotions.
Yeah, definitely. So many good points that you brought up in all of that. And one of the things that I actually thought about whenever you were talking about is just the cadence of conversation is so different too.
Right.
And something that we have worked on in therapy with kids too is when you get an email or you get a message sent to you, you can take time to think about what you want to say, how you want to say it, like in the best way possible. And then we have kids who are confronted with something in real time, and that's where we're losing the ability to properly express how we're feeling, because they're so caught off guard that they have to react in real time that sometimes it comes off as embarrassment or anger, or because they don't have that processing time. I mean, the same is true when I get an email. If I get an email, I can really debrief and think about what I want to say. But in real time, it's hard. And it's not always confrontational things, it's happy things too. And that's just one thing that I don't think parents have had to think about before. So I always encourage modeling the cadence of a natural conversation, and working through issues in real time versus over text message, even in the family, just to work on those problem solving and the real life correspondence that you just miss through social media.
Even the phone, I think things are so different these days with technology. I mean, my kids don't talk on the phone very often. And so I've actually lately been trying to teach them to, okay, you make that appointment for yourself, or you call and do that. And it's just like, oh, wait a minute, before, we didn't have all this stuff before. And so I had to pick up the phone and talk. And at least, even though you can't see facial expression, you can hear the cadence and the intonation in their voice. So that totally changes the meaning of what people are saying. And so I think that's a big problem these days in terms of misinterpretation. And so, I don't know. I think we have to change the way we're communicating these days because of the format that we're communicating.
Yes, definitely. Yeah. I mean, so many good points to being brought up in conversation, but I think we really should talk about, what to do then if we are seeing some of these things with our family. So first line of defense for you, do you try to coach the family? Do you refer? What's kind of the trajectory of what you do?
Right. So that's very individual. It kind of depends on what's going on. It varies from person to person. When we do our well visits, we do a couple surveys related to anxiety, depression. If something shows up there, then I'll talk to them about it. And I'll tell you, people are failing those surveys every day these days. So we're dealing with a lot of mental health issues, and it's become a big problem. And so it's sometimes hard to differentiate between, oh, it's just a normal teen thing, it's the hormones, whatever, versus is this really a problem? And I think you have to look at how it's changing in their daily lives, for one thing. Is this something that's been going on for a long time, or suddenly something changed? What's going on there? Are they not doing the normal daily activities that they usually do? How are their relationships with the other kids? Are they isolating themselves? Are they, spending time with friends, or not wanting to do things with other people? How are they in school? Are their grades suddenly, they were always straight A's and now they're doing poorly? What happened there? Are they not eating, or are they overeating? You know, sometimes there are kids or adults too who are stress eaters, and when they're stressed, they start eating more. And there are others who, you know what, I'm just so nauseous, I can't eat, so they start losing weight. Are they sleeping okay? They're having trouble falling asleep. They wake up throughout the night. They're tired all the time because they're not getting enough sleep. Their mind's just racing, and they're, you know, worried about things, worried about what's happening the next day. What's their motivation level like? Do they feel like, oh, I just, you know what, I just don't have the energy to do anything. I used to like to, I don't know, play basketball, or I like to, I don't know, hang out with my friends, or I used to play video games, and now, you know what, I just don't want to do that. If you see them isolating themselves in their room, or they're having a lot of conflict with family and siblings, you know, really irritable, getting angry or crying. Some of those things can be seen in younger or older kids, you know, crying more, just lashing out, irritable. And sometimes people don't realize that that irritability and anger is really a sign of anxiety or depression. So it's something to look out for. But it's very individual, you know, not everybody reacts the same way to things. Those are some warning things that I would say you probably should look into further. But like just, you know, what I see and who I'm going to send for an evaluation is going to depend on, you know, what they say, what the child says, and everything. But I'm sure the evaluation is different also from your standpoint, Alexa. Like, how do you decide which way you're going to go there?
Yeah, it's again, case by case. We get a lot of the same history that you do from the family of how long has this behavior been going on? Are there any patterns to it? And then try to see how it's affecting the child. So as an occupational therapist, we work on the jobs of an individual. So the job of an adolescent or a child is to play, to interact with peers, to go to school, to be an active participant. So if it's interfering with one of those things, we take different approaches. For our younger kids, we use programs like zones of regulation, how is your engine running, to really work on identifying how our body feels. And with some of these older kids, it's more of that executive functioning approach. You know, are we stressed and anxious because we've made a really big jump in school? So now we need help organizing our day-to-day, whereas before we didn't need that. In the speech therapy realm too, are we unsure of how to interact with our peers, and that's causing us these frustrations and these outbursts? So do we need to, you know, improve with how we're communicating with others? So really we could go a bunch of different ways, but very similar to kind of what you look for, signs of when maybe it's more of like a psychosocial issue that requires an outside referral, is decline in that school performance, eating, sleep disturbances, like you said, persistent non-compliance. So this is a big one right now with sensory. We see, you know, big caseload of kids who need help with sensory regulation, or is it a behavior? And so we try all those sensory approaches to give the kids the repertoire of strategies to handle when they're feeling, you know, that they are having trouble listening. Is it because they're overwhelmed and they can't concentrate, or is it because it's defiance? So we try our best to look at what may be a sensory issue. And then once we kind of parse out that it's probably a little bit more behavioral, we send to maybe parent-child interaction, or another outside referral in cognitive psych. But we do our best to try that sensory regulation route first, and then refer if we need to. And then obviously, you know, if the mood changes, if we go from really happy to really sad to really angry to really, you know, manic almost, that's another one that might warrant an outside referral. And if there's any history, sometimes we have parents that aren't linking the two. You know, oh, we did actually do parent-child interaction theory therapy 2 years ago, and now we're seeing this, and it's like, well, it's always a sliding scale, so we might have to revisit that. So kind of getting a really good background on those kids as well, to help the parent, you know, maybe recognize that it's just a familiar pattern that needs a little kickstart again.
Mhm. Yeah, I
But
think some of that
always,
depends on their developmental age too. So like we were saying, that there's different milestones, and if you're at a different developmental age, it might still be that same thing showing up differently because the child's older now. So I think that's a good point.
yeah, yep, definitely, because kids who are 4 to 6 are going through different things than kids who are 12 to 14. But if they had issues at 4 to 6, they might still have issues with another big jump in their life, whether it's changing schools or, the added pressures of getting older. So we do see some of these kids who have to kind of cycle back around, and the parents who also have to cycle back around to help them out with any transitions for sure.
Mhm.
But definitely
treatment looks different too for those kids.
totally.
Older. It's a different treatment plan, and how you deal with those kids is going to be different.
And that's one thing that I tell parents right away is it's not like a fine motor issue where this is usually what we do and that's usually what we see works. We have to really play around with the kid and what they benefit from. One kid may really like talking about their emotions. So something like zones of regulation works really well because the kids are articulate and they can understand the feelings. And then another kiddo might not respond to that program. So then we have to take a different approach. And it's a lot of parent modeling as well. So I give them strategies, but I'm with them 1 to 2 hours a week. They're with them all the time. So modeling appropriate ways to respond or to acknowledge when I'm frustrated or a scenario that might make me nervous, even going back even that far, just really coaching these kids along that it's not kind of like a one and done type thing. It's an ongoing process for everybody. Mm-hmm. Reading through here. Yeah. I think we talked about our warning signs and everything like that with parents who are kind of on the fence about where to turn to first. So we agree bringing it up to your pediatrician is definitely the first step. And then the referral from there, it's never a bad idea to get an evaluation. And then like we said, there's a couple different avenues that it could go. But that initial evaluation it's kind of the first step.
Right. Yeah, I think it depends on the child, but if people are unsure, I think it's a good idea to reach out and see if a further evaluation would be useful or not.
Mm-hmm.
As concerns, there's something that tells them that, I think you should go with your gut and
Mm-hmm.
what the next step should be.
Mm-hmm. And I think we identified there's so many factors that play a part in emotional regulation, and every circumstance is different too. So even between kids of the same family, that first child may have never experienced outbursts or tantrums. They never had to work on transitions, but maybe the second kid needs a little bit of help, just, so kind of encouraging families too, that every child is different.
Mm-hmm.
And it's not, if you have one kid that is one way, it's not going to be the same necessarily for the second one.
Right. Each one is individual. I also think there's something to birth order. So that second child is not born into the same family the first child is. And even though they have the same parents and somewhat similar DNA, everybody's individual. So every child has to be treated as an individual.
Totally. Yep. I agree.
Well, I don't see any other questions from the audience, but if you are watching this on our social media, please feel free to go ahead and leave your questions in the comments section and we will get back to you. A lot of really good information here. This was really enjoyable. So I just really want to thank Alexa and Dr. Hwang for joining us today.
Thank you for having me.
Yeah, thank you for having us again.
Alrighty, and this video will be posted to our Facebook. So thanks everybody for joining us today.
Awesome.
Bye-bye.
Thank you.
Bye.